the Applied Practice Experience. My name is Lee Taggart, and I'm the academic advisor for these students. And I'm excited to have 3 students presenting today. Our first student is Nicole Boysen, and she did her practicum with DPHHS. And her site mentors are Mackenzie Jones and Jessica Keachley. And the name of Nicole's presentation is Health Communication Through Storytelling. So I'll let you take it away, Nicole. I think you're muted, Nicole. Just you can unmute yourself.
All right, there we go. Well, thanks for the introduction, Lee, and good afternoon, everyone. My name is Nicole Boysen, and I'm looking forward to sharing my applied practicum experience with you. And my project was focused on health communication through storytelling via a story map, and also contributing to a risk map with data research to basically help improve health education and resources for the Montana Department of Public Health and Human Services, specifically the Chronic Disease Prevention and Health Promotion Bureau. I had the pleasure of working with 2 site mentors at the Montana DPHHS, Mackenzie Jones and Jessica Keachley. And I want to give an honorable mention to Brian Nordrud for the many hours he volunteered to work with me and the StoryMap software, and then also to DPHHS for providing me with a stipend for my work. So upon meeting Jessica and Mackenzie, they shared the recent Montana State Health Improvement Plan highlighted priorities for improving the health of Montanans. And one of the priorities was chronic disease burden with key risk factors identified as obesity, physical inactivity, and poor nutrition. So from that, the obesity prevention subgroup was formed by Montana health professionals to improve and support healthy lifestyles for all Montanans and subsequently lower the prevalence of obesity in the state. Now you can see on screen, I have 2 graphs depicting the growth of adult and high school student obesity in Montana over the last couple of decades. And the Montana State Health Improvement Plan's objectives were to decrease the percentage of Montanan adults who are obese from 26 to 23%, as well as to decrease the percentage of Montana high school students who are obese from 12 to 9%. So the obesity prevention subgroup identified a need for a singular platform to showcase the state's multiple resources. So this need created the first product I worked on, the story map. But due to the stigma surrounding the word obesity, the group really wanted to focus on presenting this information positively and inclusively. So the Joy and Healthy Story Map was created. And then the other need presented was contributing to a future obesity prevention risk map, because creating a risk map can offer several benefits, from targeted interventions to resource allocation, research, and etc. So before the internship, I had never been exposed to story maps. This story map uses ArcGIS. It's a general geographic information system that is used to explore, visualize, and analyze data. ArcGIS story maps are effective in bringing information to a variety of viewers in an interactive way. So this tool is used for digital stories and presentations to communicate, persuade, and then connect with the audience. I really enjoyed learning how to navigate and create within the information system. So the obesity prevention subgroup decided to use the system to raise awareness. And with the story map increasing and supporting access to available healthy lifestyle resources and programs, it would then in turn support the larger Montana State Health Improvement Plan objectives, which focus on decreasing obesity rates in Montana. So the video on screen is the actual story map I helped create for my practicum. While it scrolls through, I'll describe, what it contains. The obesity prevention subgroup had started the map with different kinds of health content. So I had reviewed the content with my site mentors and focused on their audience by assessing their needs, confirming the message would communicate strategies to different audiences, creating structure throughout the page, and then also delivering current and expanded resources for the different communities of Montana. The audience was identified as the general community, and the story map identifies statistical health facts for Montanans in its comparison to the United States. This evidence can influence and educate, And there's also inclusive resources for food, physical activity, and health programs showing locations all over Montana with contact information and representing all races and cultures within the state. Now, the message to the reader throughout the story map is to discover what sparks joy and motivates them to stay focused on their health to help combat obesity. Now, 65% of the general population are visual learners, so I structured the page with attractive color themes, inclusive pictures, user-friendly links, printable health education materials, and digital tools, simple data maps, accessibility, and a variety of health-focused programs. With delivery, I took into consideration that American adults they read between a 6th to 12th grade level. So I used the Flesch-Kincaid scale to measure and help create the story map content at a 10th grade readability level. Now, this project does not stop here. The story map will continually be updated to be as useful and accessible as possible. Another possible way to help support communities and their obesity prevention could also be a risk map. It can create different layers to evaluate obesity risk factors at a county, region, or state level. And local health professionals or coordinated contractors for different organizations can utilize these maps to increase funding for specific health projects. And so when you can improve access to health programs, it can help positively impact health outcomes. So there are many steps to completing a risk map, and this is another new exposure for me. I've seen end products for risk maps, but I've never been part of like the beginning process of gathering the data. I contributed by researching data on risk factors for obesity, such as physical activity, eating behaviors, sleep environment, etc. And I was able to locate data in forms of a CSV Excel spreadsheet online at the Centers of Disease and Control and Prevention, census.gov, and other websites. And then I compiled it into a document with data dictionaries for the subgroup to utilize. The data I collected is from BRFIS and Youth BRFIS, which is the Behavioral Risk Factor Surveillance System. And it's the nation's premier system of health-related telephone surveys that collect state data about US residents regarding their health-related risk behaviors, chronic health conditions, and use of preventative services. Also, obesity stats were pulled from the Montana Hospital Association, from hospital discharge data, and census data. And since I have a minute, I wanted to share what I also did for my volunteering. So I live in Austin, Texas, and Texas is a very hot state. Older individuals, they can experience heat exhaustion or worse with temperatures of 80 degrees and higher. And just last year alone, we had 212 days of 80 degrees and higher temperatures, with 80 of those 212 days reaching 100 degrees and higher, and usually consecutively. So the Family Elder Care Fan Drive works completely off donations, with volunteers delivering over 7,000 fans annually to older individuals in need. This concludes my presentation, and a big thank you to my site mentors and to the DPHHS.
Thanks, Nicole. Great job.